name is Shanika Anderson, and I will be doing my informative speech on abusing the use of the emergency room. Emergency rooms were created to treat patients who are dealing with a trauma or critical illness when there is not enough time to be present at a doctor's office. The emergency accepts patients 24 hours a day, 7 days, no appointment needed in advance. Some patients that are not critical or dealing with psychological issues makes the medical treatment difficult present themselves to the emergency room. The frequent presence of these people causing emergency room overcrowding and abuse. Abuse in emergency room is ongoing and is becoming priority over critical illness. The number one problem in overcrowding emergency rooms today in America is the patients are drug seeking. The patients are experiencing certain mental illness behaviors to receive narcotics from the emergency room physicians. Most of the patients use pain as their number one complaint to obtain prescription drugs. The true intentions of this drug-seeking patients will be unknown while the doctor is caring for the patient. Studies have been conducted to show that the frequency of drug seeking are causing the emergency room to be overcrowded. The frequent visitors cost the hospital billions of dollars. The studies have shown that frequent visitors consist of people included in a social culture, psychological setting. To reduce the utilization of the emergency room visits, the patient needs for pain management has to be looked at as a holistic view. The patient needs to be healed in a whole to stop the dependence on the medication to heal their pain. Hospitals creating a track record on how many patients frequent for pain medication will decrease the abuse of the emergency rooms. Overcrowding emergency rooms has been the number one topic in urgent care setting. And as my visual aid shows here, the use of emergency rooms are used again for trauma and critical care. The abuse that are attempted in emergency rooms are patient complaints of phantom pain, patient is dealing with mental illness, and patient is intentionally hurting self to receive pain medications. Many of the visitors are drug seekers who abuse the emergency room for the pain medications. These pain medications consist of opiate-based medications. These opiate-based medications, also known as narcotics, are sought for non-therapeutic reasons. The abuse causes the emergency room to be overcrowded due to frequent abuse. The overcrowding causes the emergency room to overflow, causing inadequate care who are there for real emergencies. Emergency room staff have to change and then take staff assignments to accept the chronic pain patients. Quote, the hospital ED has a case management program that functions to assist in the care management of difficult patients in the ED, particularly those patiently frequently seeking emergency care problems related to prescription medication, end quote. The emergency rooms are coming up with solutions to stop the frequency of the non-medical issues. Behaviors of the mental illness is causing abuse to the daily basis. Complaints consist of patients complaining of pain in the back, dental pain, migraine headaches, and to obtain medication. Pain is the number one complaint. Drug seekers used to be seen in the emergency rooms. The doctors do a rollout of the systems in the body that causes the pain, in which they offer the 0 to 10 pain monitor. The drug-seeking patient yells out a big 10, and pain is everywhere. Then the emergency room doctor tries to pinpoint the cause of the pain. But when the patient yells everywhere, the doctor does not know where to start. Quote, as the symptom of pain is subjective, it is often difficult to differentiate between the two. It is the responsibility of the care provider to treat pain, but try to avoid enabling drug seekers. The true intentions of the patient seeking opiate drugs are unknown by the doctors. And as in my visual here, you can show the increase that's in the gray over the years of the drug seekers, and you can see the decrease in care over those years that's in the orange. And how is the issue being fixed? The states that are now putting in monitor systems to track drug seekers. They're treating the patient as a whole, holistic care, and they're training the doctors to recognize drug-seeking behaviors. This practice will help the doctors identify who are the drug seekers and non-drug seekers. As researchers advise, quote, engaged individuals experience a greater reduction in ER visits and inpatient admissions and a smaller reduction in office visits. Prescriptions over time then did not engage individuals, end quote. If the doctor engages with the drug seeker, the doctor can gain what is called an individual act to such a behavior to seek opiates on a frequent basis. The emergency room practices this type of care and will decrease the abuse and cost in the emergency. Fixing the issue in the emergency rooms are to incorporate a process for the staff to identify drug seekers as they enter the emergency room. The first task is to train all the emergency room staff, including doctors, security, to identify certain behaviors the patient might show as suspicious. Drug seekers are very persistent and impatient patients that want to get their drugs and be released. States have now put in a system to drug seekers. The monitoring system forces the emergency room to monitor the behaviors and the frequency of the drug-seeking patients returning for medication. These patients present with behavior of impatience, complaints of pain, and same indirect and very friendly behavior with the doctor. The monitoring helps the doctor to narrow in on the behavior. The doctor will be able to predict where the drug-seeking patients will complain about the area of pain. Abusing the use of the emergency room starts with the emergency room take responsibilities for dealing with these patients. The emergency room should follow up with the patients after visiting the emergency room. This persistence will motivate the patient to seek medical to solve the pain management of their illness. Healing the patient as a whole should be the must for the doctors. This method of dealing with chronic pain will decrease the drug seeking, overcrowding the emergency room, and that is a very serious problem all of the emergency rooms. Solving the problem will benefit in millions of dollars. Thank you.